Welcome to this session on getting started with Visual Hospital Manager or VHM as I would refer to it during this session. Now, prerequisite for this session is that you have installed Visual Hospital Manager or VHM on your computer already using our installers. Now, agenda for this session would be to launch the VHM, then walk through the master data setup and do some configuration settings. And we will do this live through the application. So let's go to the live demo. Now, when you have already pre-installed the application, you would see a icon like this on your desktop, or you can search it through your start window. Now, let us launch the application from here. I would double click this. Now, when you start VHM for the first time, it will ask you basically for your hospital or clinic name. Now, this is how the interface of the application looks. Now, let's say I'm going to call this Sanjeevani Hospital. Then there is a year that it asks you to define. Now, this is not really an accounting year, but this is a partition of the data that is created for whatever year you specify. And then for the sake of aligning it with our April to March financial cycle, I'm going to call it accounting year 2023-24. So whenever I start VHM next time, I would get a selection between different accounting years. One of the advantage of this is also that your data is partitioned across all these years. So even if you use this application for 5 years or 10 years, it will not happen that the data has become too much and application has slowed down. At any point of time, it will be operating only on this particular partition of the data, which keeps it always speedy and fast. All right. Let's say OK. Now it has created a partition and now it is asking you if you want to retain the master data. Now this master data is something that we have provided you by default in the application. You may choose to remove the master data by saying no here. It will provide you a completely clean slate. But we advise you against it because then it is a lot of work to do to set up the master data from the beginning. And it will delay your starting to use this application in practice. So let's say yes. Now username and password to start with, you can use these username passwords. And then I would get into the application. So I'm into the application and here are different menu options that you have that you can use to run the application. Now we are going to look at master data. Now, for example, I go to laboratory names. This is where I define if my hospital, as a doctor, I'm referring to myself now, if my hospital has different diagnostic centers. So for example, it may have a laboratory, it may have an infertility investigation center, it may have an ultrasound clinic and so on and so forth, maybe CT scan, MRI, and that kind of clinics. So I just go on adding them here and then I save this. Next item would be to define investigations under these particular laboratories or diagnostic centers that we defined. So let's say under hospital laboratory, I have added all these uh, tests. I've defined them. Then under ultrasound clinic, I've defined some. Under X-ray clinic, I've defined some. And if I have a new clinic, I can define that new clinic and add new tests under that clinic. It's absolutely easy. Now, if we look at each test here, for example, abdomen KUB view. Now this has a memo where you can write some notes about this by default. And then when this test is done for the patient, those notes would be imported for the patient and you can modify them there. So it becomes a patient's report. The template here that you type will remain intact. Then you can see there are 7 categories of charges. Now I have specified only first category. We will see what these categories are. Because normally in any hospital, these categories are not used widely. Only one rate list is there for all the tests and other charges. But in case your hospital is supporting normal price list, CGHS, maybe a separate price list for a associated hospital, then you could use this category 1, 2, 3, 4, and then specify respective charges. here. So for example, if I specify 130 for category 2, I specify 140. For category 3, I specify 110. Now, when I add a patient into the system, I associate a category of charges with the patient. And then accordingly, from that category, those particular charges will be added to patient's bill due, depending on whatever investigation is assigned to the patient. So this is how basically this entire laboratory or diagnostic center and the investigations work. Then next we would go to the diagnosis. Now we have added some diagnosis by default. These question marks indicate that you can prioritize those in the list if they are most commonly used diagnosis. But otherwise, these are just all the diagnoses we have picked up and we have put in here. You can go on adding new diagnoses that you practice and then save that. So they are available for you to select when you are adding patients' clinical details. Then procedures. So you could have daycare procedures specified here. You can add new procedures. You can remove whatever procedures you don't want to practice or you don't use it in your hospital. And then you can also add a memo here for a particular procedure. Now, for example, this is a sample memo I have added uh, by one of our doctor who is using our software. And then I save it. So if I want to edit it, I can say edited notes here. And then I can save it. So next time when I open the memo, I see edited notes here. And then you would see M capital wherever there is a note. It would be small m of memo if there is no note behind this particular procedure. So this is how you can interpret. Then operations, I can define operations here, and then I can define charges for different categories of patients. I can also add a memo here. So this is sample operation note memo. Of course, this can be much more meaningful. I'm just giving a demo here. And I save this. So again, you can see that this aim is become capital because there is some memo defined for this particular operation. You can add operations, you can delete operations if you want, and then save it. Then let's look at bill breakup first. Now, these are different services that your hospital or clinic offers to the patient. You can go on adding new services or you can delete the services as usual. And you can also categorize them between indoor OPD services, diagnostic services, indoor OPD services, and then accordingly, you can specify also the charge. Now here you don't have any categories, there are fixed charges. And you can always change these charges when you add them for the patient's bill. There is also a facility of setting up bill breakup printing order. Because you go on adding this bill breakup, as we call it, in random order, you can still set an order here. So they will be arranged in the bill in this particular printing order. Now let's look at prescription dictionary. Now, as we know, medical prescription or medicine prescription is a very important aspect of medical documentation for a patient. We also provide a facility whereby you can print this prescription in multiple languages. And this is where I can actually define different terminologies used in a prescription. And then there, for example, here you can see Marathi translation or Hindi translation, Gujarati translation, and so on and so forth. We will see this, how it is used when we prescribe a medicine for the patient. You can add new words and then you can add these translations. Okay, the next level would be about stocks. So here you can define medicine groups and medicine names. So for example, if I have defined amoxicillin as a group, then these are different medicines that I define under it. Each of the medicine, you can specify that it's a syrup, how many times a day, and what is the dose normally. And then you can go on adding new medicines. You can remove unnecessary medicines that we have already provided in the master data. And then you can also add new groups for defining the medicines. Of course, we have provided some set of medicines based on what our doctors have been practicing and what is in the market. But We advise very strongly that you go through these medicines and go on adding your own medicines from different brands, which is latest in the market, and that will really help you make your prescribing medicines very fast. Similarly, we can also define some stock. So there could be different stock items added here. You can specify the purchase rate. You can specify the selling rate at which you want to charge the patient if it is used for the patient. And then, of course, there are opening stock and reorder levels that you can maintain here. So please use this to add more items and delete the stock items if they are not necessary. Then in staff details, you can specify the details of consultants who are visiting your hospital, whose charges you would bill to the patient. You can go on adding new consultants or delete the consultants. Then also information about the referring doctors that you can go on adding here. Account details. Now this is not an accounting system really, but there are some basic functions related to the patient like payments and receipts and stock management that we need to do. For that, you are able to then define different accounts. So cash in hand, for example, salary account, you can add employee names here, and then you can also manage it within this system. But again, this is not an accounting system. Then you can define different checklists. So for example, here I can define a checklist called pre-operative preparation. And then I can specify the memo. So prepare the patient. Second, prepare the OT. Third, sanitize equipments. Fourth, contact anesthetist. Anesthetist for availability, and so on and so forth. So what I'm essentially doing here is I'm preparing a checklist that before an operation, I would just take a printout and tell my assistant that please take care of all these items before we start the operation. And you can define checklist for example, admission. You can define a checklist that when a patient is admitted, there are 1, 2, 3, 4 n number of things to be done. So that is how you can use this checklist. So you can just print it very quickly from there and I can view it. So this is a checklist that I had defined for pre-operative and I can just take a print by clicking print button here. Next, it is calendar. Now this is a calendar which you can use to define certain important aspects. So for example, birthday of Satish. So this is some kind of a table calendar. You can just switch between the dates and you can see what is basically specified for that particular day. It's a kind of a reminder for you.